Good morning, Dr. Karan here. And in this video, I'm going to talk about symptoms of heart attack. And that is myocardial infarction. Some symptoms are classic, very typical, and then some of them are atypical, less obvious and often missed. So let's talk about the classic symptoms, the typical symptoms. They are the ones most people recognize really due to reduced blood flow in coronary arteries. Number one, chest pain, pressure, often described as heavy, squeezing, or burning sensation, not sharp stabbing. I may feel like an elephant sitting on the chest. And there are always some other associated symptoms. For example, it could be sweating, shortness of breath, and some radiation to a pain, usually to the left arm, shoulder, jaw, and upper back. Sweating is usually cold and clammy kind of sweating. We call it diaphoresis. So that's, and then it may be associated with nausea or vomiting or palpitation or lightheadedness, like a feeling faint, and you have a feeling of impending doom. You feel that something is wrong, something bad is going to happen. So those are very typical symptoms. Now, atypical symptoms. The typical symptoms, classic symptoms, are usually seen in males, and they don't have other problem like diabetes or they're mid-age as well. Atypical symptoms are more common in women and patients with diabetes and older individuals. In those situations, the pain distribution through the nerves are not transmitted typically. So what could be those symptoms? Indigestion-like discomfort, heartburn, stomach pain, unusual fatigue and weakness. And that could be the only symptom in women. Women usually have those symptoms is they feel fatigue and weak all of a sudden. Back pain between shoulder blades, and that's also atypical symptoms. And jaw, neck, and throat discomfort. Sometimes that can present as a myocardial infarction. Shortness of breath without chest pain. In those kind of cases, I like to get them workup done, get the EKG at least, and send them for a stress test or have a cardiology consultation. All of a sudden, if there is an onset of confusion in elderly people, altered mental status confusion, those could be symptoms. Silent heart attack, no symptoms at all. And sometimes only picked up later in EKG or imaging studies, more common in diabetics though. Sometimes you know that people are found dead in their sleep, a silent heart attack, causing ventricular defibrillation. So the key takeaways are these. Men usually present with classic crushing chest discomfort, chest pain. Women, elderly, and diabetics often present with atypical symptoms, like that delays the diagnosis and you're not thinking that this could be because of heart issues. So I would say that any new unexplained chest discomfort, jaw pain, shoulder pain, back pain, stomach discomfort, especially with sweating and breathlessness, should be treated as possible heart attack until ruled out. So like the video, save it, and share with your friends and families. And thank you for watching.